I accept and acknowledge everyone's way of thinking about and going about their life when they come through a hard circumstance. Everybody has different ways of coping with it.
Sure.
And I
Absolutely.
think that's very healthy and normal. But for me, I didn't accept it. I pushed on to learn more. And even through my physical therapy career, I didn't learn enough. So I kept learning. And one of the ways that I kept learning was through dance. And I initially entered dance to help with just happiness. I used to dance when I was younger, and I love it. I love the expression of dance. I love that dancers have to tell a story. I love the feeling of finding new places in your body that movement brings you. Everything about dance is amazing. So learning more about the body through dance and not just seeing it as a way to move for mental health, but that through technique, through proper technique in areas, I could actually, lubricate my joints, help my joints. And even if I couldn't do the technique properly, I could have strategies basically to help strengthen myself in those areas while I learn to do the technique properly, or while I'm still learning to do the technique properly, to protect those areas so I can continue to do what it is that I love, to continue this quality of life that I have. And now proudly I can say that I rarely ever have pain.
That's nice.
And it's been a long journey to probably talk about all of that would be like a whole nother series of podcasts.
I've been watching your little videos with your patients on Facebook and how their testimonies, how they came in feeling a certain amount of pain, and then really in one visit, several of them have felt relief, which is, I'm sure they're so excited, and that's amazing.
An affinity to physical therapists. We do have a doctoral level education in movement science, many cadaver labs. As far as I know, in the medical industry and otherwise, we have the greatest education as far as body movement goes as a profession. But with that being said, you have to go to someone, that you can relate with, that you can connect with.
Yes.
That may be not the most important factor, but the most important factor might be someone who really knows what they're doing and talking about, someone who can spend the time with you. And then 3, you have to be open to what it is they're doing and give it a chance.
Yeah.
And some of it's trial and error. So even as a physical therapist, it is definitely the practice of physical therapy and the practice of medicine. We're still practicing as well, just like dancers practice. So go back to that PT or that practitioner, give them feedback on what you liked about what you did, what you didn't like about you did. I always tell people,
give up on it.
Instead of just give up, you have to find the right person that's going to be receptive to that type of feedback and, challenge them back, because you're the only person inside of your body. We can look and we can see, and some of us have very good observation skills, and we've studied this for a very long time, taken very many courses, great techniques, but at the end of the day, you're the only one that feels what's going on inside of your body.
Yes.
So you're the best person to be your own advocate, to come back, say, you know what, this thing that we did is working, but this might not be. Another thing that people do sometimes is they take everything and they do it together in physical therapy. They don't section out, hey, this one movement helped, but this one movement didn't. It takes a lot of cultivation of body awareness. And in general, back surgeries is a tough surgery because the likelihood that you're going to have success is much lower than some of the other surgeries out there.
It's just a fact.
Right.
That's why I don't have them cutting on me at all.
And your spinal cord runs through your spine, any type of spinal surgery, whether it's your neck. I consider your neck also your back. So just anywhere in the spine where there's a lot of muscles, there's a lot of nerves, of course, a lot of bones. And then after your body settles, you tend to get pain in the segment above or below, if not the segment that you're having it. And then dysfunction, like we call referred pain, to other parts of your body as well. Now, like I said, with that being said, there's always a caveat. So there are always people that absolutely need back surgery, something like central spinal stenosis, where the whole spinal cord is at risk of basically being compressed, stuff like that. But even when you have shooting pain down your leg and you have an MRI that shows a compressed nerve, there's been many MRI studies that have shown that you can take a person who is in no pain off the streets and do an MRI, and they might show a compressed nerve on their MRI.
That's interesting.
Versus somebody who's in pain might not even show a compressed MRI, and they're in excruciating pain. So what I tell people about MRIs is it's the best imaging that we have to look inside the body. If we had like a microscope or like a see-through machine, like an X-ray that shows all of the soft tissues, but it doesn't show the whole picture. It doesn't show what's going on actively, physiologically in the body. It also doesn't show all of the reasons we have pain and all of the reasons we don't have pain. But it's the best thing that we have, and we should definitely go by it, but it's not always accurate to what you see in the MRI versus what's going on in your body. Mm-hmm. So to say, slip disc, MRI equals back surgery, equals a lot of times people say, I tried PT. Well, yeah, maybe you went to a clinic where sometimes they mostly use techs to do some of the exercises. All practitioners, I feel like in general, we get into it because we want to help people, and we do, but it takes a savvy consumer just to get the best help possible. Mm-hmm. So I think just help yourself and be your best patient advocate.
Take control. I love that you're saying that. Yeah, and I absolutely agree with you. And enough.
Oh, absolutely.
Right, exactly. So I do get short-term results, and it's because of techniques that I use. But I do it because I know sometimes people need to feel that buy-in at that initial visit if they're skeptical. So luckily, I've done enough study and research and practice to where I can do that now. I don't get success with everybody, the first time. But the more I practice, the better it gets. But the thing is it's about repeating what it was that gets that short-term result, because that short-term result doesn't last. But what I tell them is if we can get a short-term result, that's usually the hardest part, to figure out what helps you the most. Because many people search many years to try and figure out what helps you the most. So if you can get to a practitioner that can see it in you immediately, that's going to speed up the time to figure out what's going to help you the most. Because like as you said, Jose, there's some great practitioners out there, but they might not just be for you.
Yeah, they don't fit you.
So do you think that there is a particular type of person or patient that you do really well with, that gravitates towards you? Or do you have all different walks of life?
My favorite patients are patients that are motivated, of course, right? We all want motivated patients.
That helps.
And patients that really need a true problem solver, that are willing to work with somebody who will take the time to problem solve their issue. My favorite people are just people who want to get back to a sport sometimes. Maybe somebody somebody who wants a problem solver who will take the time to try something different and new. My techniques are based off of a lot of new sciences, and it's because I had to find the new neurofascia, if anyone's heard of fascia, sciences to help myself best, rather than doing the tried and true stuff that I was trying. So somebody who's open to something new.
I like that.
Cool.
Yeah.
Dr. Meena knows her stuff.
She does know her stuff. And again, it's like you said, you got to be able to, you got to want it. If you're going to, just healing. Look, I know the exercises, they suck, but you got to do them.
Mm-hmm. Yeah. Well, see, I try to tell patients, I don't want to give you an exercise that you think sucks, because it's about a feeling that you have in your body. And if most people, what I find, if I give them a targeted exercise that they feel good doing and they are mentally aware, this is helping me immediately, they're going to keep doing it.
Yeah, absolutely.
So even if, say, a physical therapy program might typically be 15 exercises, I might give you 3, because these 3 are going to be the biggest impact in your life. These 3 you're going to enjoy doing because you're going to like the feeling you get when you do them. And that's where I feel like a lot of practitioners go wrong, is they'll treat, oh, you know, your arm went this high before and now it goes this high, so now we have success, which is a measure that we can measure. It's very important to measure those things.
Range of motion?
Range of motion, exactly. But when it comes down to it, it's the feeling that the patient gets while they're doing the treatment and after, long-term and short-term results. And it all goes back to how the patient is perceiving their feeling to be. And so that's where the science of fascia comes in. And that's the cutting edge of, I feel like, where therapy is going to go in the next 10 years, but it hasn't quite gotten there yet.
Just getting going.
Oh,
Yeah.
interesting.
There we go. We're learning by leaps and bounds here today.
I know.
Who knew? Beauty and brains. I like it.